And health news, 4 new cases of measles have been reported from a county just north of Houston. So the total cases continues to climb in our country, with more this year than all of last year. And medical expert Dr. David Winter from Baylor Scott & White joins us now to explain his concerns for the spread. And Dr. Winter, let's talk about what do these new cases indicate to you?
Yeah, I think it's a real shame, Kara, because in the year 2000, measles was declared extinct in this country. Now, since then, vaccination rates have gone down, and in the year 2019, measles has come back, and we see every year it's come back more and more. This is a horrible disease. It's said to be the most contagious virus on the planet. If a child with measles walks to a room of unvaccinated children, 90% of those children will come down with measles, so highly contagious.
So what are the symptoms of measles?
Cough, fever, fatigue, runny nose, red eyes, these red spots on your face that then go the rest of your body. You can also get complications. It can get in your lung, causing pneumonia. It can cause encephalitis, a brain disease. It can cause blindness, deafness. About 30% of kids who get this disease will have to have hospitalization for some complications. So it's a very serious illness, not only for kids, but also for adults who get it.
Yeah, that was my next question. Does it affect mostly children, and do the symptoms differ at all if you do get infected as an adult?
Yeah, the large majority of people are under age 20 who get this. Most of them are very, very young, but older adults can get it also if they've not been vaccinated. Now, the vaccines do work. If you had a vaccine, you're probably safe. If you're not sure if you had one, a blood test can be done to see if you have immunity, because the vaccine lasts for a lifetime.
And you mentioned the vaccines. Let's talk about any side effects. Obviously, you know there are concerns out there about the MMR since it doesn't just cover measles. We're talking about mumps and rubella. So can you address those concerns?
Yeah, a lot of studies have looked at this. And what they've done is they take kids who have not been vaccinated, who have some kind of disability, and then kids who are vaccinated with some disability, and look and see if there's any difference. There's no difference. There's no increase in disability or side effects from kids from the vaccine. So the vaccines are safe, also safe for adults. The vaccines work. We got vaccination rates up again. We can get rid of measles like it was back in the year 2000.
Now, what do you think it would take to see people change their minds at this point, since you're saying that we're seeing more cases year after year, we're going in a different direction?
Yeah, I just think we need to get the information out, because this has been studied. It's been very clear that the measles shot does not cause any serious side effects. So we need to get those studies out. I think more information, talk to your doctor. They all know about this, so that will help also. If you have any questions about this, talk to your physician. But yeah, we need to get the word out, because the vaccine is safe and measles doesn't have to exist in this country.
All right, Dr. Winter, good to see you. Thank you so much for your insight.
Thank you, Kara. Good to be with you.